Hello, everyone. My name is Shalini Jose, and I'm currently a third-year medical student from the University of South Florida Morsani College of Medicine. Before I get started, I also want to note that my classmate Sonal Sian equally contributed to this research. Today, I'll be presenting on our research that focuses on investigating medical student knowledge, attitudes, and perceptions of human trafficking and need for training in the United States. In terms of the main findings, we found that gender and human trafficking knowledge significantly predicted attitudes towards sex trafficking victims, with female students having more knowledge and better attitudes towards victims. Having higher knowledge about human trafficking was also an important predictor of positive attitudes, highlighting the need to improve training. Our data suggested that medical school curricula should integrate human trafficking topics, including ways to improve doctor-patient interactions to detect trafficking, encourage empathy, and foster positive attitudes towards helping survivors. It is important to note that characteristics of the students, such as gender, age, race, ethnicity, and year in medical school, need to be considered when tailoring the curriculum. Through our literature review, we found there was a lack of healthcare provider awareness and negative attitudes regarding human trafficking victims that currently pose significant barriers to providing effective care to victims. Physicians are also one of the first healthcare professionals to come in direct contact with a victim of trafficking, and therefore can have a significant impact in terms of providing victims with appropriate resources and healthcare aid. The current level of medical student awareness regarding human trafficking and medical student attitudes towards victims are also unknown, and medical students will be future providers. Thus, it was important to assess their knowledge, attitudes, and perceptions in a way that could identify and address gaps in current medical training regarding human trafficking victims. In order to conduct this research, a questionnaire was sent out via email, resulting in a self-selected study sample of 172 medical students. Medical student knowledge was assessed using a validated human trafficking knowledge instrument composed of 22 true and false questions. Medical student attitudes and perceptions were measured using a validated sex trafficking attitude scale, which included 6 Likert type subscales, including 1, attitudes towards ability to leave sex trafficking, 2, efficacy to reduce sex trafficking, 3, knowledge about sex trafficking, 4, empathetic reactions towards sex trafficking, 5, attitudes towards helping survivors, and 6, awareness of sex trafficking. The differences in the attitude scale scores were assessed using the quality of means t-test. In terms of multivariable analysis, we used multiple linear regression to assess whether student characteristics predicted overall knowledge and/or attitudes towards victims. Our analysis found that medical students had a high level of knowledge about human trafficking with an average score of 19 out of 22 correct responses. Although student attitudes varied by gender, ethnicity, and year in school, after adjusting for student characteristics, only gender significantly predicted human trafficking knowledge. In fact, the proportion of incorrect knowledge varied by gender for the following items. 1, awareness of the role of healthcare providers in the notification and involvement of law enforcement. 2, child prostitution. 3, the use of tattoos to mark victims. And 4, the victim's fear of law enforcement and/or healthcare providers. As demonstrated by our R-squared value, only 9% of the variance was explained by these variables. Moving on to the results on attitudes and perceptions, our analysis found that student attitudes varied by gender, ethnicity, and year in school. After adjusting for student characteristics once again, the only variables that significantly predicted attitudes towards sex trafficking victims were gender and human trafficking knowledge. These data demonstrated that female students had more human trafficking knowledge and that more human trafficking knowledge served as a significant predictor of positive attitudes towards victims, highlighting the need to improve training for medical students. As demonstrated by our R-squared value here, 18% of the variance was explained by these variables. Ultimately, our data also suggested that potential areas necessitating reinforcement through medical school curriculum improvement include efficacy to reduce trafficking, attitudes towards helping survivors, and awareness of trafficking. Specifically, a gender-sensitive approach to designing curriculum that focuses on ways to improve interactions with patients to detect trafficking, encourage empathetic reactions towards survivors, and foster a more positive attitude towards helping survivors of sex trafficking is crucial. Further evaluation of the differences that exist between these groups of students should be carried out via a more in-depth qualitative analysis in the future. Thank you so much for your time and attention.